Hello, my name is Natasha. I use she, her pronouns, and I'm a research assistant at Fraser University. Today, I'll be speaking to you about evaluating MindMap, perspectives about a low-barrier mental health service finder for British Columbia. While we meet today on a virtual platform, I would like to begin by acknowledging the Indigenous peoples of all the lands that we are on today. I am speaking to you on the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this nation home. So to begin, it's been well documented that lesbian, gay, bisexual, transgender, queer, and two-spirit populations across Canada experience disproportionately high rates of mental health concerns, including inequities in suicide, depression, anxiety, and substance use. And many of these concerns stem from the influence of sociocultural and historical factors on the lives of LGBTQ populations. And a prominent theoretical model that accounts for these observations is termed minority stress. And this is a socio-ecological framework which proposes that chronic experiences of prejudice, discrimination, and violence, such as on the basis of gender identity or sexual orientation, are internalized, leading to health-harming coping strategies and resulting in poor health outcomes. Therefore, it's important to be able to access LGBTQ2 affirming mental health care. However, finding this care is challenging, and numerous barriers prevent access, including cost, stigma, shame, and a belief that mental health concerns are not worthy of help. Furthermore, mental health care that is not LGBTQ2 affirming can lead to further psychological harm. In light of this, in 2018, input from community members and healthcare providers highlighted the need to increase the knowledge of and access to low-barrier LGBTQ2 affirming mental health services in British Columbia. And based on this recommendation, our team developed and is currently evaluating MindMap, an online database of low-cost and/or LGBTQ2 affirming mental health services in BC. MindMap lists mental health services that accept self-referrals and are low cost, meaning free, sliding scale, or subsidized, and/or LGBTQ2 focused or with a verified commitment to providing LGBTQ2 affirming services. And the ultimate goal of MindMap is to improve the visibility, knowledge, and use of low barrier mental health services for LGBTQ2 populations. So MindMap is currently in its 6-month initial pilot phase, accessible at www.mindmapbc.ca. And there are currently 91 services across the Greater Vancouver area or the Lower Mainland that are listed in there. So the goal of MindMap's 6-month pilot phase was to elicit feedback and identify any issues with the scope or functionality of MindMap. And to this end, we aim to answer 3 overarching questions. 1, to what extent is MindMap a useful and accessible resource for service providers? 2, what changes would improve the functionality and relevance of MindMap? And 3, how can MindMap be adapted to better meet community needs during COVID-19? To answer these questions, we took a qualitative approach and conducted semi-structured qualitative interviews with key informants. So from May until September 2020, we conducted 15 interviews with service providers located across BC, primarily in the Greater Vancouver area, but also in the interior of the province and on the island. And we spoke to 4 mental health service providers, 3 health promotion and outreach workers, 8 sexual health nurses. And some context for this last decision, we decided to interview sexual health nurses because sexual health clinics are a low barrier and routine point of care for many LGBTQ2 populations. And data show that 1/3 to 50% of persons accessing sexual health clinics have a recent mental health or substance use related concern. So here are the results from the interviews. So service providers spoke to various benefits of MindMap, including that it was easy to navigate, had an aesthetically pleasing design. They appreciated helpful database features for users. And they also appreciated just having a central location for vetted, low barrier, and LGBTQ2 services and resources. Finally, they appreciated the destigmatizing imagery used throughout the site. So some quotes from our interviewees speaking to the role of MindMap are as follows. So first of all, I thought it was a really nice way that the map and the resources come out when you actually do a complete search. I thought it was clear and easy to go between in a way that would be helpful for my clients. Another interviewee noted, doing a kind of central database for queer and trans affirming services is really helpful in my work and also in the community and in my personal life. A third interviewee noted, a lot of times, if you're working in an institution and you're an outlier, you kind of speak to racism or you speak to transphobia and homophobia, blackphobia, you're quite isolated. So I think MindMap can be an interesting way for bringing practitioners together too. Interviewees also noted some suggested changes to improve MindMap, including developing and displaying mental health and substance use resources for clients directly on the website, expanding the scope beyond mental health and substance use services to perhaps also include sexual health services, changing some of the search input categories and filters to better, to improve the overall searching experience, and to clearly define the categorization of LGBTQ2 affirming services. Finally, a few interviews noted that some design features could be updated, such as including more images and reducing the text. There were also 4 COVID-19 related changes that emerged. So the first one was to add a remote counseling feature, adding a suggestion about directly contacting services for updated information about COVID-19 protocols, making the link to emergency services more prominent, and finally, adding additional information about COVID-19 specific resources for users. So our current progress in implementing the changes suggested from our interviewees. So first of all, for the COVID-19 changes, back in June, we administered a survey to providers listed in MindMap to document whether they're offering in-person and or remote services, and these updates have since been integrated into the database. We're also creating tailored trans, two-spirit, and LGBTQ filters. And to do this, we're currently working with community members and organizations to develop a set of criteria to identify services that affirm the experiences and identities of trans, two-spirit, and LGBTQ people. And finally, we're in the process of changing the website host. So we're working with a web developer to move MindMap to another platform for improved security and flexibility. And moving forward, our next steps with MindMap are to translate the trans, two-spirit, and LGBTQ criteria into a survey for services listed in MindMap and classify them accordingly. We'd also like to use these criteria to develop guidelines for service providers to help them become more trans, two-spirit, and LGBTQ affirming. As noted, we would eventually like to expand MindMap to include services outside the greater Vancouver area so that the services are representative of the entire province. And finally, we will eventually do a widespread launch of MindMap with promotion from the LGBTQ2 Roundtable and other community agencies. So in summary, mental and sexual health service providers supported the use of MindMap as a referral site. And with modifications and further input from community members, MindMap can better meet the needs of people accessing services and service providers to connect LGBTQ2 clients to low barrier mental health services. Our hope is that MindMap becomes an accessible and LGBTQ2-centered mental health resource site to help mitigate the disproportionate burden of mental health challenges among LGBTQ2 populations in BC. Thank you very much for listening to my presentation. If you'd like to continue the discussion or have updates about MindMap, please feel free to get in contact with me or other members of the research team. And I would just like to say a big thank you to these organizations and funders, as well as a particular thanks to all of the members of the Sexual and Mental Health Applied Research team. Thank you.